A LocSSiP is a local safety standard for invasive procedures. As per the LocSSiP, the team should perform a number of checks before the procedure is carried out.
Patient ID confirmed. ID confirmed. Patient consented. Indication.
Vasopressors, sequences.
Correct form.
Yes, we need a central line.
Correct length.
16 centimeters.
Mandatory assistant present. Present. All equipment and monitoring present, including an ultrasound and sterile probe.
Yes.
Allergies, clotting, and platelet levels checked.
No allergies, clotting checked.
A timeout is performed prior to the procedure commencing. All team members' names and roles are assigned. The position of the patient should be optimised, and if necessary, excess hair should be removed with clippers. The skin should be cleaned with 2% chlorhexidine, and it should be ensured that there is a sterile field in place. It should be checked that the operator has a hat, a mask, that they've washed their hands, and that is with antiseptic soap, and they should be wearing a gown and gloves also. At this point, there should be a pause, and any concerns should be raised by team members to ensure patient safety. During the procedure, the operator should confirm the anatomy using landmarks and ultrasound. They should make note of the local anaesthetic that is used. Firstly, they should visualise the needle directly on ultrasound. An intravenous gas sample should be obtained. The guide wire should be visualised, and this should be in both ultrasound planes, horizontal and longitudinal. If indicated, blood culture should be taken for the new CVC, and the whole procedure should be undertaken with strict aseptic technique. Team sign out. The final checks and team sign out should include 2 team members. We should check if the guide wire is removed. A sterile technique should be used to fit the injection site caps. The length of the line measured at the skin should be recorded, and a venous gauge should be obtained for the CVC. All ports should be aspirated freely, and they should also be flushed with 0.9% saline. The line should be sutured securely, and a sterile dressing should be applied by the operator. A venous waveform should be seen on transduction at both proximal and distal ports. Lines sited in the internal jugular vein or the subclavian vein will also require a chest X-ray. The box entitled Approval for Use should be signed if all the mandatory checks are satisfactory. The chest X-ray is performed to demonstrate the satisfactory position of upper torso lines. It's also there to confirm the absence of complications like a pneumothorax. The findings of a chest X-ray should be recorded on the LocSSiP, as well as any deviations from the protocol, such as failed attempts and complications. More information on LocSSiPs, and particularly the CVC LocSSiP, can be found on the UHW ICU SOP for non-tunneled CVC lines.